Multicultural Centre for Women's Health is a national organisation that promotes the health and wellbeing of immigrant and refugee women across Australia. We've been going for almost 40 years now. The key issues really for migrant women are around sexual and reproductive health and their rights in relation to sexual and reproductive health. We know that there are poorer outcomes, which means that migrant women are less likely to access services at an early point or access preventative education and information, and therefore find themselves more likely to be in the acute and crisis end of the system. Mental health is also a big concern, and that's really to do with stresses of migration, social isolation, issues in workplaces. They tend to be dirtier, longer hours, and fewer protections and lower pay. We take a social determinants of health approach, which means that there are a whole lot of social factors that impact on women's health. And one of the big issues that is coming forth, and I guess a lot more people are talking about violence against women now, and even for women who aren't directly subject to violence, the threat of violence, gender inequality, all of that impacts on women's health. We're promoting gender equality within migrant communities and in the general community, specifically for migrant and refugee women, and also we're working in the area of the prevention of violence against women. I think there's a lot of room for improvement in our health services. There's, on the one hand, a lot of room for improving the cultural responses to migrants and refugees. I think on the other hand, we really haven't taken our opportunity to build up an ancillary type of health sector. I think we've got a lot of capacity in Australia because we've got a really big migrant community. We have a lot of people who are bilingual and who in fact come to Australia with great skills and qualifications. And I don't think we've harnessed the benefits that that can bring. So I think, yes, we really do need to improve health system responses to women. Let's make better use of bilingual workers. They can really be a great link for women to find out more about their health and to actually get a good service when they enter the health system.